So imagine this for a second. You're strapped down to a heavy wooden table. You are completely, agonizingly wide awake. A surgeon approaches you, and we're not talking about someone with a gentle bedside manner here. He's holding a literal saw. And the only comfort you're offered for what's about to happen is a piece of leather to bite down on. Welcome to this explainer. What we're diving into today is a genuinely terrifying reality. Because, for thousands of years, this wasn't some horror movie nightmare. It was just standard medical practice. Today, we're exploring the wild, bloody history of general anesthesia and how humanity fought tooth and nail to finally wake up from the dark ages of early surgery. I want to hit you right away with this chilling fact. 50%. Before the invention of modern anesthesia, literally half of all surgical patients died. Half of them. They either perished right there on the operating table from the sheer overwhelming shock of the procedure, or they succumbed shortly after. The stakes couldn't possibly have been higher. Going in for surgery wasn't a reliable path to healing. It was basically a coin toss with death. And what about that 50% who actually survived? Well, early surgery was an absolute last resort. These procedures were essentially bloody, traumatic races against time. Because the patient felt every single cut, the surgeons focused exclusively on speed, just going as fast as humanly possible to limit blood loss and agony. There was absolutely no time for careful precision. This frantic pace led to a staggering 80% of surgeries resulting in severe infections. And the survivors? They were left scarred for life. They carried a deep, lifelong psychological trauma from the horrific pain they had to endure while completely conscious. So the crucial point here is that humanity desperately needed a way to operate without sensation. In ancient Greek texts, we actually find the word anesthesia. It's a combination of the prefix an, which means without, and aesthesis, meaning sensation. Now, it was actually Oliver Wendell Holmes in 1846 who formally proposed we use the term anesthesia for the medical state itself and anesthetic for the agent causing it. But long before Holmes gave it a catchy name, ancient civilizations were trying absolutely anything to achieve this state. Which brings us to Section 1, Ancient Potions and Soporific Sponges, Desperate Historical Workarounds. Let's take a look at the bizarre, potentially lethal concoctions our ancestors used to knock people out. Just think about how crazy these medieval mixtures actually were. Take a look at this 13th century English potion called Dwale. The ingredient list reads like a witch's brew. Bile, opium, lettuce, bryony, henbane, hemlock, and vinegar. Hemlock, that is a famously deadly poison. This was a highly toxic, alcohol-based mixture. You'd give this to a patient hoping to knock them out, but here is the truly terrifying part. After the surgery was over, to wake the patient up from this deep toxic stupor, surgeons literally had to rouse them by vigorously rubbing vinegar and salt directly onto their cheekbones. Ouch. Over in the East, they had their own fascinating innovations. In 2nd century China, there was this legendary surgeon named Huatou. Historical records claim he performed major operations. We're talking things like the resection of gangrenous intestines using a highly secretive formula he called Maface Sun. It was an oral potion, basically a cannabis oil powder mixed with wine, that actually induced a state of unconsciousness and partial paralysis. But there's a real tragedy to Huatou's story. The exact composition of this medical marvel was lost forever, simply because he burned his manuscripts right before his death. So, let's move into Section 2, the party drug breakthrough, the Wild West of the 19th century. For centuries, we were basically stuck with dangerous herbal potions and alcohol. But the ultimate medical breakthrough? It basically started as a parlor trick. Get this. Ether frolics. In the late 1830s, you had these wandering lecturers in the northeastern United States hosting massive public gatherings. They would actively encourage audiences to inhale diethyl ether or nitrous oxide, what we know as laughing gas, purely to show off its mind-altering properties. People would get high, stumble around, laugh hysterically, completely make a fool of themselves, and bump into things. It was literally just public entertainment. They were completely unaware they were holding a medical miracle right there in their hands. But some sharp observers in the audience noticed something incredible, and this triggered a rapid-fire succession of accidental discoveries. Dentists and doctors attending these frolics noticed that participants who bumped into heavy wooden tables and severely bruised themselves felt absolutely no pain, zero. So in 1842, physician Crawford Long actually used ether to painlessly remove a tumor, though he unfortunately delayed publishing his findings. Then in 1844, a dentist named Horace Wells saw a man massively injure his leg on nitrous oxide without even flinching, and he successfully started using it for dental extractions. By 1846, William T.G. Morton had a massive, highly publicized success with ether, and just a year after that, James Young Simpson introduces chloroform. Suddenly, all the puzzle pieces were finally coming together. This brings us to Section 3, the ether dome miracle, waking up the medical world. This is really the climax of our medical horror story.
Picture this scene. It's October 1846, inside the Massachusetts General Hospital. Dentist William T.G. Morton administers ether to a patient named Edward Gilbert Abbott. Then, the prominent surgeon John Collins Warren cuts right into Abbott's neck to remove a tumor. Now, in the past, a cut like that would be accompanied by blood-curdling screams, but Abbott, he remains completely silent. He feels absolutely nothing. Warren is astonished. He turns to the audience of medical professionals packed into the operating theater and utters this legendary phrase, "Gentlemen, this is no humbug." And just like that, the news traveled around the world like wildfire.
But of course, what followed were some weird geographical rivalries. You'd think everyone would just agree on one thing, right? No way. The medical world totally split on which gas was best. Britain and the American South stuck firmly with chloroform. Fun fact, Queen Victoria even used chloroform during childbirth in 1853. But the American North, they abandoned chloroform entirely and went back to ether. Why? Because chloroform had this terrifying tendency to cause fatal cardiac toxicity and sudden heart arrhythmias. Basically, your heart could just stop. Ether was definitely more irritating to the lungs, sure, but it was far, far less likely to randomly kill you on the table. All right, on to Section 4, perfecting painless surgery, escaping the dark ages. We are finally moving out of the chaotic 19th century. So we had the drugs, but the delivery was still incredibly crude. The crucial evolution here was in airway management. For decades, the standard was just a drop mask, which is exactly what it sounds like. They were literally dropping volatile ether onto a rag placed over a spontaneously breathing patient's mouth. Super imprecise and very dangerous. But in 1928, Arthur Goodell introduced the cuffed endotracheal tube. This was a total game changer. It sealed the airway, allowing anesthesiologists to put the patient into a much deeper sleep because they could finally safely control the oxygen flow. And then, tragically propelled by the massive polio epidemics of the 1950s, mechanical ventilation became the standard. Anesthesiologists could now completely take over the patient's breathing. This is what made those massive, complex, hours-long chest surgeries possible for the very first time. And alongside the breathing machines, the 20th century pharmacological arsenal evolved incredibly fast. In 1934, we get sodium thiopental. That's the first intravenous anesthetic. Then in the 1940s, doctors started using Curare. Now get this. Curare was originally a poison used on blow darts, but they used it as a highly effective neuromuscular paralytic block, literally stopping the patient's muscles from twitching during delicate surgeries. In 1956, halothane was introduced. This was amazing because, unlike ether, it wasn't flammable. So no more risk of accidental operating room explosions, which is definitely a plus. And in 1960, Paul Janssen synthesized fentanyl, a massively potent painkiller. All of these innovations together built the incredibly safe, heavily controlled modern hospital environment we completely take for granted today. Which really leaves us with this final thought. Just look at how far we've come. We've gone from being strapped down and biting on pieces of leather, to swallowing toxic hemlock, to inhaling explosive gases during a parlor trick, all the way to the highly precise fiber optic guided sleep of modern medicine. It is a completely miraculous journey of human ingenuity. So, I have to ask, the next time you're lying on a pristine hospital bed and an anesthesiologist casually asks you to count backward from 10, will you remember the centuries of absolute nightmares it took to bring you that peaceful sleep? Thank you so much for exploring this vital and slightly terrifying chapter of medical history with me. Keep learning, and I'll catch you in the next explainer.